In the summer of 2011, Chris Currie's life changed when his heart went into fibrillation. Despite numerous tests, doctors were unable to confirm why this had occurred. Today, Chris returns to St George's Hospital to speak to Professor Sanjay Sharma, hoping to finally get a diagnosis for his condition.
Feeling a little bit nervous, but yeah, also excited, hoping to see Professor Sharma, and may help to get a step closer to finding out the cause of what's been going on with my heart.
I'm glad we could finally meet up. I understand that you've had quite an eventful 2 years, which started in Bangkok in 2011 when you nearly lost your life.
Yeah.
Would you like to tell me a little bit about that?
As far as I know and can remember, I was in a bar in Bangkok and I was talking to an Australian girl and I collapsed. But she was a medical researcher, so who was up to date with her CPR, etc. So she had realised sort of fairly quickly what was going on, and she started CPR on me, and I think that's what kept me alive until I reached hospital in Bangkok.
So your heart had actually stopped,
Yeah,
and she did all the cardiopulmonary resuscitation until you got to hospital. And then what happened in the hospital? I mean, you probably don't remember, but did they have to give an electrical shock to get the heart going again?
I think they did have to give me several shocks.
Yes. You went into a coma.
I was in a coma for a while. Oh yes, and they then put me in a medicated coma as well, because I became exceedingly agitated at the situation, and it would just they figured it would just be safer just to put me into a medicated coma for a while to help my body to recover a little bit.
That's right. I guess what's happened is that when your heart stopped, there wasn't enough oxygen going to your brain, and as a result of that, the brain becomes quite swollen and irritable, and people become very confused and very difficult to manage, and sometimes it's easier to look after the heart and the brain if someone's completely sedated for a little while. And how were you when you came round? Were you confused?
I think I must have been very confused because I don't remember. I remember very, very little of my time in the Bangkok hospital. But I think I must have been very, very confused.
He was very agitated. Every opportunity he ripped the needles out of his arms and legs, and he had to be strapped down, physically strapped down, arms and legs to across his chest to keep him still. Otherwise he couldn't get any medication in him.
Okay. And how long was it before that you started having a recollection of what was going on?
I can't remember when I started to then be able to know what was going on. It was probably. I don't know exactly how long I was in hospital for, but it was probably a few days. Okay. I would say, at least, before I could figure out what was going on.
And what did the doctors say to your family?
They were reasonably confident that he would make a recovery. Their initial job really was to patch him up and get him home, and that's what we wanted as well. And then we started the real work when we got home.
And did they offer any explanation for it?
They tested him, constantly in the time that we were there, and their conclusion by ruling out what they couldn't prove was myocardiopathy. That's what they decided that it had to be, because they couldn't find anything else.
So they thought it was a viral myopericarditis, or a viral myocarditis, an inflammation of the heart muscle, possibly due to an infection.
Yes.
Okay.
But they couldn't prove it.
And had you had a cold before all this happened?
I don't think so, but unfortunately, I can't remember anything really at all from. I think it happened on the 6th or the 7th of January, and the last thing I can remember was a very, very little tiny bit of New Year's Day. Okay. So, and I was at for New Year's Eve, I was in Vietnam. So
Okay.
I didn't even know I was back into Thailand.
And you hadn't taken any funny things or agents or experimented on anything whilst you were there?
Not that I'm aware of, no.
Had you ever had any symptoms like blackouts before this happened?
I don't think so.
Had you ever noticed your heart racing for no apparent reason?
No. Again, no. From what I can remember, I don't think I've ever had anything.
His two friends, again, because that period just before has disappeared from his mind completely, had said that he stumbled on two separate occasions only about a week or so beforehand. And Chris put it down to just feeling a bit funny and he tripped. But they
Okay.
were convinced that it was more than that.
And you say you've never felt your heart racing for no reason.
I don't think I have, no.
Have you ever been told you've got a heart problem, or have you ever had a diagnosis of any heart conditions or a murmur at all?
Not that I know of.
And in terms of a family history, is there anyone in the family that may have died young or has a heart condition diagnosed at a young age at all?
No. I've discovered only last week that my sister, who's just coming up for 50, has an irregular heartbeat, and her heart races constantly, and she is aware of it. But until last week, I wasn't aware of that.
In terms of fits, anyone in the family suffer from fits?
No.
Has anyone had an unexplained road traffic accident whereby they just couldn't explain what went wrong?
No.
Has anyone drowned? Any drowning accidents in the family?
No.
And you weren't taking any regular medications or antibiotics before any of this started?
Again, I don't think so, no.
So effectively what happened in Bangkok was you were at a bar, your heart stopped suddenly, you were lucky enough to with someone starting CPR, you managed to get into hospital, they did various investigations and thought you may have something called myocarditis,
Yeah.
and tried to patch things up.
Yeah.
Clearly this is obviously very serious, and I suspect they probably wanted to do something to ensure that it never happened again. So you've now got a defibrillator in. How have you been since your defibrillator? Has it gone off at all?
It's gone off a number of times. I think it's 3 times in total. No, 3 separate occasions it's been. Or was it 2 separate occasions? I can't remember.
It went off 12 times
In one go.
in one session in Greece,
Yeah.
and then another 4 times it went off in September this year.
Yes. Yeah.
And each time it went off, did they tell you whether these were appropriate shocks? Had you lost consciousness before it went off?
I definitely lost consciousness while I was in Greece before it went off. I know I was quite violently sick but that was from drinking.
And each time it's been appropriate shocks. And the second time after Greece, where did you go the second time?
I was at home. I was in bed. What I can remember is that I'd had a great deal of trouble trying to get to sleep that night, and from what I can remember, I think I'd finally dropped off, and then the next thing I suddenly woken up with a fairly severe pain in my chest, and I think my defibrillator had gone off, and so I then shouted, and Mum came into my room, and it then went off again. I think once more while at home, and then I think twice more when I got to A&E.
Okay. Wow. So what an ordeal. So an aborted sudden cardiac death, a defibrillator in situ that's gone off twice and probably saved your life on 2 occasions.
Mm-hmm.
So I guess you're here today for us to rewind a little bit and see if there's any light we can shed on what may have caused all of this.
Yeah.
But one thing I can agree for sure is that you do need your defibrillator, and I think that's been proved.
Mm-hmm.
So the decision to put a defibrillator in was correct, because there's obviously a condition that you have that's putting you into a very dangerous rhythm. There are numerous things that can cause that. These can either be things that affect heart muscle or the electricity of the heart. And we can normally find a cause in about 80% of cases.
Mm-hmm.
But there is that small group, that 1/5, where despite all the tests we do, the diagnosis still eludes us, possibly because there are many electrical faults that we don't know how to detect, and I think that's probably what it is. So that's what we're going to do today. We're going to go back and do the ECG, the heart scan, do an exercise test. I hear you're a very good sportsman.
I was.
I'm nowhere near what was your sport?
What wasn't my sport? I mean, I still play hockey, squash, cricket, golf. I go skiing.
And have they said you can't play anymore?
They haven't said I can't play any of them anymore. And the ones that they've said, I've said, well, I either do it or I don't. If you're saying I can do it, I'm doing it properly, or I'm not doing it at all. But I don't play badminton anymore because I can't. My hand-eye coordination, because of my brain injury, just doesn't seem to isn't good enough anymore. So I just can't. I can't play to how I would like to be able to play, and it frustrates me greatly.
Do you take any medications at the moment?
I've fairly recently started taking beta blockers, but a very, very tiny dose,
yes,
as small as possible.
And is that because you're having symptoms?
I don't know.
They put him on them after this last session in hospital because there's just
they don't know
desperate
why. Yes.
to try and stop it happening.
Well, I guess it's probably best if we now start doing some tests to see whether we can shed any light on any of this.
The ECG had those many times, so just normal for me really. No struggle whatsoever with that one. The echo that I had, that was, as it's always been a little bit unpleasant for me with having my defibrillator under my arm and having to lay on that side, makes it a little uncomfortable. The VO2 max test was absolutely knackering. It gets you seriously out of breath. Maybe struggle big time.
You've had all your tests, the ECG, the heart scan, and a gruelling exercise stress test, and you did really, really well. Mm-hmm. You're clearly keeping fit, from what I can see here.
Fairly.
do you ever have any problems? Has your defibrillator ever gone off when you're exercising?
Not as a result of exercise. No, not at all.
So the 3 attacks you've had have occurred at relatively resting conditions. One you were having a drink with someone. Mm-hmm. The second one.
Second one when I was ill,
you were vomiting when it started, and the third one you were lying in bed.
I was in bed, yeah.
Okay, very interesting. So, never been brought on by this type of sport as such. Your ECG shows that your heart's going quite slow, at 33 beats per minute. That's partly due to the fact that you're fit. When people are fit, they've got big hearts, so the hearts don't have to contract too often to pump 5 litres of blood around the body. But it's also partly due to the beta blocker that you're taking. This artificially slows the heart rate down. I couldn't see anything actually wrong with the complexes themselves, which is sometimes a clue as to what may be wrong.
What's a complex? Sorry?
These big spikes,
right.
We call these complexes.
Right.
There's nothing wrong with what they look like, and there is nothing obvious like Wolff-Parkinson-White, which is an electrical fault. You're sometimes born with an extra electrical pathway, or the long QT syndrome, which is a molecular defect that affects the electricity of the heart. I don't see any of that. So we scanned your heart, and the heart scan showed that the left pump looked very good, pumped very well. The right pump was a little bit bigger than it should be, but it did pump very well. There's a small area just at the base of where the right pump is, which looks like it doesn't work quite as well as the rest of it. Now, that may be because you've had 10 or 12 shocks in that region, and that may be the reason why it doesn't do that. If you look at Fabrice Muamba's heart, for example, and he had at least 33 shocks, we find that part of his ventricle there, that part, doesn't quite contract as well as the rest. So I'm not saying that that's the explanation for why Chris has had these episodes where his heart's gone into a dangerous rhythm that's stopped him from breathing, etc. I just think that may be a function of the shocks that he's had. Your exercise capacity is excellent. We did the cardiopulmonary exercise test, and it's obvious that you gave it your very best, because despite having been on treatment like beta blockers, you managed to get a maximum heart rate of 158 beats per minute, and that's really saying something. And the cardiac function, that's your heart pump function, was very, very good. Your peak oxygen consumption measured 55, which is 120% of that predicted. That's the sort of thing that you see with athletes who aren't on treatment. So we're left with a young man who's had an aborted sudden cardiac death and is very lucky to have survived it, who has a defibrillator in situ, which has gone off on 2 separate occasions and appropriately. So there's obviously something seriously wrong with him. But what is not clear, despite relatively comprehensive assessment, is the precise cause of this problem. It could be an electrical fault that we don't recognise at the moment. But what I would certainly want to do is to contact the hospital where all these investigations have taken place, especially the invasive ones, like the adrenaline provocation test, just to see what they actually made of that result. And if I had my own way, I'd probably want to repeat the adrenaline provocation test, just to see what we're actually dealing with, because these episodes of cardiac arrest occurring at rest are very suggestive of certain ion channel problems, like the Brugada syndrome, which normally cause deaths when someone's actually resting as opposed to when someone's actually exerting themselves, which is quite different to what most of the deaths that we see in athletes. They normally occur in conditions where exercise or surges of adrenaline bring these things on. In Chris's case, it looks like it occurs when he's got hardly any adrenaline on board, i.e. when he's lying down in bed, or he's retching. In fact, when you're retching, your adrenaline levels are at rock bottom.
All right.
He
has had an adrenaline test.
Yeah, yes.
It didn't show anything.
No, it wouldn't have done. But I wouldn't mind seeing his adrenaline provocation test for Brugada, because that may show something, and it really varies on where it's done and who's done it. As we stand, he is a little bit of an enigma, and we have to accept that sometimes we don't have answers. Being optimistic about the whole of this is that we have a young man who is alive, who is enjoying a good quality of life, who is still playing sport, and who has something in place for when things go terribly wrong. So I would suggest that he's monitored, and obviously with the advances in medical practice at the moment, I have no doubt that we will have answers. It's frustrating, of course, not having answers immediately, but I'm sure answers will become apparent, and we're learning every day with science. And I think with us having sequenced the whole of the human genome, it's only a matter of time before we actually find a genetic background of problems that you've got. Right now, you carry on as you are doing. So that leaves for you to ask me questions.
Oh, I must have questions. I can't remember them.
Yeah.
What about you, Yvette?
Life is just very difficult for him to move forward without this diagnosis. He's struggling to accept what's happened. Yeah. And I think this last episode has finally sort of driven home that he is actually ill. I think we've all been in denial, really, all of us, to a degree, because there's been no answer. And that would give us something to try to use as a stepping stone.
I think you're right. Certainly there are terms such as idiopathic. Idiopathic in medicine means we don't know.
Yeah.
And he's probably been labelled as idiopathic ventricular fibrillation. Yes. And I think it's honest to say idiopathic rather than make a diagnosis up. You know, sometimes you can make a diagnosis up and say, I suspect it's this, and someone hangs their hat on it. But at the end of the day, it's academic. Because whether he's got idiopathic ventricular fibrillation or Brugada, he still needs his defibrillator. Yeah. And he still needs to take some of the precautions that he may have been given. And the family should also be tested. Have any of you been offered testing?
The three of us have been tested.
Did you have an adrenaline provocation test as well?
No, we did an exercise echo and ECG. Just those three, and nothing came out of them as far as I was aware. Again,
I know that you've had a faint.
Yes.
And clearly this may be quite relevant to what's going on. So I do recommend that you are re-investigated. I know you've had tests done before,
Yeah.
but the thing about these conditions is that we don't necessarily understand the natural history of these disease processes. Some of them are quite new to us. And in his case, we don't even know what's actually precisely going on. So sometimes a repeat assessment of first-degree relatives or of the individual suddenly clarify what was actually going on. And I'm sure we will have answers here. It may take time and repeat assessments.
But if it were Brugada, what could you do about it?
Good point, and that's why I'm saying it's academic. If it was Brugada, there's only one thing that saves lives in Brugada, and that's a defibrillator. There are no tablets that save lives in this particular situation. There are some people, and this is assuming that if it was Brugada, who keep getting these shocks that do respond to an agent called quinidine, but it's not the sort of drug that you put someone on without a diagnosis.
Right.
So that's why I was just thinking that we should maybe revisit the adrenaline provocation test.
What does that actually tell you? I know the name, but what does it tell you?
It tells you whether someone's got Brugada or not.
Right.
So obviously these tests vary, the results, and where they're done, how they're done, which dose of drug was used, which leads were looked at.
Oh.
So lots of things can really determine whether a test is deemed positive or negative. I would say that if there's only one thing I would have done, not having known Chris's case very well, I'd probably be keen to look at the adrenaline provocation test, not necessarily repeat it, but maybe look at it just to see how it was done and which leads were looked at. And if I was satisfied, that would be the end of it. If I wasn't, I may want to recommend that it's repeated again using a certain protocol. There are illicit drugs such as ecstasy and cocaine, which obviously no one should take, not just you. There are, if it's Brugada syndrome, not that it's going to affect Chris because they're mainly psychiatric drugs, tricyclic antidepressants, drugs that schizophrenics take. There are certain heart rhythm disturbance drugs which he clearly isn't on. Binge drinking is not a good idea.
No, well, we found that one out.
We normally tell you that's what it's making me look like. It looked like it may be a Brugada type thing, you see, and also. We don't like people immersed in hot water for a long, long time.
Well, again, you don't do. You shower, don't you?
High temperatures, saunas,
I don't like
very,
saunas
very hot.
particularly.
Exercising in very hot climates because high body temperatures can bring this on as well.
Okay.
Well, it's very nice seeing both of you, and
really
Chris, I think you need to be optimistic about the whole thing because you are enjoying a good life. I agree that you've got a defibrillator in, but you would have had one in. No matter what the diagnosis was, so whether it was hypertrophic cardiomyopathy or ARVC, it wouldn't have changed the fact that you were a victim of sudden cardiac death. You'd have had this box in. The only difference is that your condition doesn't quite have a recognised name. But in terms of the academics of it, you've clearly got a condition that allows you to exercise and enjoy a good life.
Yeah.
Versus some in whom they just can't exercise, they're not allowed to. So you've got a slightly better outcome.
Yeah,
than some
looking
of the
at
others.
that.
And
like
I think
that.
also the way you should see it is that the defibrillator saved your life twice. And you're a young chap. You've got a lot ahead of you. You've got a good heart that pumps very well. And I'm sure there'll be answers. It's only a matter of time.
Well, I feel fantastic to have seen you, and that there may well be some light at the end of the tunnel, as it were.
I have no doubt there will be. It's only a matter of time. All these things that we used to call lots of things idiopathic, and we know answers to now. And I think we will get answers. But as I said before, you're in a good place. You've got your life back, and you've got a good quality of life, and that's very important.
It's been a very good experience. All the staff have been brilliant. They've been really nice. And then final meeting with Sanjay at the end is wonderful. It's good, very wonderful to hear that there may well still be a positive outcome of definitely finding a diagnosis for me. That's really, really positive for me. Definitely feeling more upbeat now. Having seen Sanjay, be told that there is something, it's just a case of medical science needing to catch up with me, as it were. It sort of makes me feel a little unique, possibly.